Hey everyone, it's Ed. Welcome to another edition of EDTalks and another friend of mine, Dr. Minal Shah. Minal, welcome to EDTalks.
Thank you, Ed. It's great to be here.
So we connected in person at HIMSS, and I found you to be super, super fascinating. Your background, and you're a clinician, and you do some cool things. You really do three things. You're primarily a clinical informaticist at Common Spirit, but you're also a practicing hospitalist, and you're helping to build out as a medical director of virtual care hospital medicine in the Rocky Mountain region. And so you wear all these different hats, and you're a super nice person. So I'm like, I want to have you on Ed Talks.
Yeah, no, I felt the same when I met you. You do such interesting work, and I'm glad we get the chance to chat.
Yeah, and you live in one of my favorite parts of the country in Colorado. And so I know that when I get out there sometime this summer, I will let you know. And you hopefully you can join me on some sort of adventure like climbing a 14 or maybe Pikes Peak or something.
Yeah, I would love that. I live in Colorado Springs and I see Pikes Peak outside of my window every single day. So I'm very fortunate to be able to do that. But Ed and I were talking at a conference and we realized I had never actually climbed a 14er. I have not, and it's on my bucket list. So yeah.
I'm definitely coming out this summer, and we're making the plans now, and we're definitely going to make opportunities for anyone to come do a 14er or two. And so I'll definitely make my way down to the Springs. And I've got several things I need to accomplish there, and one of them would be I'd love to meet up with you and meet your husband and your family. So that'd be kind of fun.
Yeah, absolutely. I'm looking
So
forward to
tell,
it.
what is it like? Like that's hard. Like I've had two jobs at the same time before, but you have like three. How do you do it? How do you make it work?
Yeah, the interesting thing about all three of these roles is they really feed into each other. So expertise in one area really helps me in another area. So it can be challenging at times, especially when all three roles are ramping up at the same time, but I find it very rewarding. And I really get the opportunity to lead in our health system at different levels and helps me really connect with folks from across the system in very different teams, very different roles.
Yeah, and I'm curious about your interest in virtual care because you're young enough that when you're in medical school, virtual care is already there. I mean, did you learn about virtual care in medical school? Was it part of the curriculum?
No, actually, I didn't. I trained about 12 years ago. So, at that time, I think places like the VA were doing some virtual care, virtual specialty care, but it was not a consistent part of our training or education. COVID-19 really pushed virtual care forward. And so I'm sure today's graduates are really well versed in virtual care, but it's definitely not something that I was taught or many of us were taught in training.
So how did you end up going that direction? What captured your interest?
So, virtual acute care is actually a well established specialty. Folks have been doing things like EICU for many years with great outcomes. What we're looking at doing in terms of how do we expand hospital medicine, hospital medicine's reach in virtual care, I think there are a few different models that systems use. One is the rural health model. So that's probably the one that most folks are familiar with, where you use a telehospitalist for difficult to staff hospitals. Another model is a hybrid care model. So you've got, some providers at home and some providers that are in the hospital and they work together as a team to take care of patients. And then yet a third model is where you have one virtual hospitalist that covers multiple institutions. And the value of that type of model is that it really allows you to staff your hospitals dynamically. It allows you to adjust to volume, and it's really great for hospitals that may be lower in volume but still need a physician to lead the care. So
Yeah.
lots of potential options, and it's a really interesting space to be in.
As a clinical informaticist, what is it like on a day-to-day basis? Are you doing research or is it just part of the overall operations? Just how does it work? Like from an outsider looking in, like myself, what does the day look like?
Yeah, so that's a really interesting question. I think it can look very different depending on the context of your role. I am a physician informaticist for Common Spirit National. And right now, my role is focused mostly on large-scale EHR implementation. So we are working towards getting to one instance of Epic across all of Common Spirit. So that's my primary role right now. I will say that I have been fortunate to get many opportunities leading in clinical informatics. So I spent the last year and a half starting up our innovation hospital in Colorado Springs. I'd love to show you around while you're in the Springs if you're interested,
Yeah.
so you can see some of the technology that we have built out to really enhance the patient experience and really focus on clinician enablement. I also do a fair bit of quality and safety work, optimizing clinical workflows for our physicians, and end user support and training. Another aspect of my role is deployment of AI products within our region. So I find it just a fascinating field because I really get to focus on all of those areas that I find interesting in health technology.
Yeah, you're definitely on the forefront. So if I'm a physician listening or watching right now, and I'm like, that sounds pretty exciting. I want to be like Minal. What are one or two words of advice you might give to peers that haven't really jumped in yet, in the whole virtual space or the clinical informatics space, but are interested? What are one or two things that you would advise for them?
Yeah, again, that's a great question. And I would say I was in the same space maybe 4 years ago. I actually attended the Stanford AI and Health Conference. And for me, I had no prior technology experience before that, but it was just like a lightning bolt for me. I realized this is the space that is going to be the most impactful in medicine for the next decade. And that was actually pre-Chat GPT. So the field has really blossomed since then. But I would say that, a few pieces of advice. Number one, if you're a clinician that's interested in the health technology space, connect with other physicians that are doing this work. Sometimes you'll find them within your institution. Other times you have to go outside of your institution. Find out the roles that you think are interesting and look to see how you can get some of the same experiences. Maybe that means volunteering for committees within your health system. Maybe that means offering to give feedback on a specific health technology product, but don't be afraid to use your clinical expertise and put yourself out there and voice what you want to be doing. Every opportunity I have had, it has been because I've been willing to say out loud to somebody else, I'm really interested. I want to get into this space. Like, tell me how I can be of value. And then the second thing I will say is don't underestimate the value of taking small steps towards your goal. So as physicians, we are used to having very well planned out career plans. And so it can be hard to, just think about taking small steps at a time. But those small steps can really add up. And soon you will find yourself with more experience and a larger network to really make a transition in your career.
Yeah, that sage advice, I think, for anyone, right, looking to sort of transition into a different aspect of what they're currently doing and say something, raise your hand, get actively involved, educate yourself,
Yes.
jump all in.
Yeah.
And you can make things happen, and that you're a great example of that. Now you're a leader in this space, so that's really cool. Well, this has been super informative because I don't know that a lot of people know outside of yourselves, who actually do clinical informatics work, understand all the different nuances of everything that you get to do, not only just helping with implementation and EHR things, but you're ushering in this whole new era, like with AI and stuff like that. So thanks for sharing with us and being a guest on EdTalks.